Hello, everyone. Welcome. We'll give folks maybe another minute or so to join, and then we will kick off our webinar. Thanks so much for being here today. Great. All right, we're going to kick things off and get started. So welcome. Thank you so much for joining us today for the release of our newest report, Social Connectedness through the Work, Employment, and Labor Sector. This is the third report in our series of social framework reports aimed at advancing social connectedness throughout sectors of society. We are joined by some familiar faces today, members of our coalition to end social isolation and loneliness, community and research and practice partners, welcome. And for those of you who are new to our organization, welcome. We are so glad to have you here today, and hope you find this report and webinar valuable. Please feel free to introduce yourself in the chat, share your organization role and where you're joining from. We'd love to connect. If it's your first time meeting us, the Foundation for Social Connection, we are a nonprofit organization that engages in education, promotes innovation, and translates research to practice. And that's really what brings us here today and what drives our work in developing these reports, which is focused on translating research into practice and developing educational tools that can be valuable for you and practitioners across sectors of society to implement, develop, test social connectedness solutions. And of course, today we'll be exploring different opportunities to do that through work, employment, and labor. So a quick housekeeping note before we get started, please share your Q&A, your questions in the Q&A feature after our presentation. We will take questions through that feature at the end. So if you have a question, please be sure to put that in there and we will address it at the end of our presentation. And with that, I am very excited to introduce you to the co-leads of our report, Karen Moseley and Jessica Grossmeyer. At the Foundation for Social Connection, we are incredibly lucky to have a phenomenal panel of experts on social isolation and loneliness with our Scientific Advisory Council and others that we partner with. But we knew when we developed this report that we needed to bring in experts who bridge the world of health and well-being along with work. So we're really grateful that Karen and Jessica brought their expertise to the development of this report, and really excited for them to introduce themselves and the entire subcommittee who developed this report with us. So with that, I will turn things over to you, Karen.
Thanks so much, Abigail, and thanks to you and Shannon for the tremendous support that you have given to Jessica and me and to the full committee as we work through the development of this report that we're so excited to announce today. Thanks to the Foundation for supporting the work and for acknowledging the importance of addressing it and providing support to work engagement and labor sector. So I am Karen Moseley, President and CEO at Health Enhancement Research Organization, or HERO. We're a nonprofit research think tank and membership organization that connects science to practice to demonstrate the value of a health and well-being employer ecosystem. This work is so important. Loneliness impacts health outcomes in ways comparable to smoking, alcohol abuse, obesity, high blood pressure, and sedentary behaviors. It's critical to address social connection as part of a comprehensive approach to workforce well-being, which is shown to positively impact health outcomes. The HERO Health and Wellbeing Best Practices Scorecard, in collaboration with Mercer, is an organizational scorecard that identifies the best practices for a comprehensive well-being approach. And scorecard research has found that leadership and organizational support best practices are the strongest predictor of participation in well-being programs, positive health and medical cost impact, and employee perceptions of the organization itself. And while this report acknowledges that leaders themselves experience social isolation and loneliness, more research is needed to develop solutions for leaders. I shared my own personal experience with loneliness at a Hero Think Tank meeting on the topic in 2019 and at an action forum sponsored by the foundation last year. It's important for leaders to be vulnerable and to share our stories, both for our peers and for our employees. I received overwhelming supportive response when I shared my story each time, and I hope this report will be a call to action to fill this research gap. So now it is my pleasure to hand it over to a well-being thought leader herself, my fellow co-chair and cherished colleague, Dr. Jessica Grossmeyer. Jess.
Thanks so much, Abigail, for that wonderful tee up, and Karen for that lovely introduction. Over the past 25 years, I have focused on identifying evidence-based best practices that promote a thriving workforce. And so when Abigail reached out to me and asked me to participate, I was extremely excited about looking into the research in this area. I currently work with employers and well-being service providers to advise and educate on topics related to everything from best practices in workplace well-being to measurement and evaluation to strategic planning and value demonstration. But my more recent work has focused on how organizations can foster cultures of social connection and belonging within its workforce. And so because of that focus, I was extremely excited to participate in this endeavor. And I had the great honor of meeting so many of our collaborators who served as subcommittee members in the development of this sector report. And I'll be introducing them to you in a moment. The Foundation for Social Connections approach to this report aligns with my passion for translating research into practice. That is, to draw upon what we know works, to provide guidance and recommendations to organizations on how to strengthen social connections within the workforce. And that is why it was important for us to involve thought leaders and subject matter experts who are familiar with the research, and in some cases contributing to it, while also applying it to the work they do every day to promote social connection within the organizations they serve. And so my the Foundation for Social Connection staff and my former Hero colleague, Karen Moseley, it was extremely wonderful to be able to work with all of you, and then with the following subcommittee members as well. There are four that I'll be introducing. The first is Dr. Sarah Wright. She is an associate professor of organizational behavior at the University of Canterbury in New Zealand. At the heart of Sarah's research and teaching is a focus on human relationships within groups and in organizations, with a particular focus on workplace loneliness and relationship quality. She has published in leading academic journals such as Human Relationships, Leadership Quarterly, and many others. And she's a fellow with the Higher Education Association in the UK, also a director for the Management and Organizational Behavior Teaching Society in the US. And as you can see from just that introduction alone, we've got a pracademic, somebody who is a researcher and also applying it to practice. And you'll see that in the other subsequent committee members as well. The next is Dr. Ann Cowell-Smith. She serves as the Chief Executive Officer and founder of Reflection Point. Reflection Point uses facilitated discussions of powerful stories to build bridges, flip perspectives, and deepen shared understanding. Ann and Reflection Point have worked with organizations all over the world in 8 languages to foster inclusion, innovation, and collaboration. She has worked with several consulting firms in major leadership roles. And prior to joining one of them, McKinsey, she practiced corporate and securities law in private and corporate settings. She earned her AB from Bryn Mawr College, her MA from the University of Michigan, and both her JD and DBA from Case Western Reserve University. Dr. Elizabeth Click is the medical director and an associate professor at Case Western Reserve University. And it was through Dr. Click that I met Ann Cowell-Smith for the first time and became familiar with her work. Dr. Click created and directs the university's faculty and staff wellness program and provides strategic support for the implementation of population health initiatives. Her professional pursuits focus on wellness and behavior change efforts for individuals and groups within corporate and academic organizations. Dr. Click received her doctorate from the Case Western Reserve University. She's a certified wellness practitioner And prior to joining faculty, she managed the wellness training program at the Progressive Corporation in Cleveland, Ohio. So again, here you see somebody who's doing research and also applying it to practice, both within higher education as well as in business. Finally, I'll introduce Dr. Nicole Ellison, a professor of information in the School of Information at the University of Michigan. She is best known for her research in the fields of computer-mediated communication, social media, and social networking sites. Dr. Ellison has made foundational contributions in the areas of computer-mediated communication, mediated interpersonal interaction, and self-presentation, use of social media in organizations, relationship initiation and maintenance in online contexts, and online dating sites. That's a vast array of experience. She's currently serving as the editor-in-chief for the Journal of Computer-Mediated Communication. And given the role that we know technology plays in either contributing to or diminishing social connection, especially in the workplace, it was extremely critical to us that we bring in Dr. Ellison's expertise. And so with that, I'm going to turn it back over to Abigail to take us through some of the report highlights.
Great. Thank you so much, Jessica. And thank you to Karen, Jessica, our entire subcommittee. And also in developing this report, we had the opportunity to meet with different subject matter experts across the field. I think we are joined by some of you today. I'm really grateful for everyone who contributed their thoughts, research, and perspectives to develop our report. Next slide, please. So before we get into the findings and what we learned through developing this report, I'd like to sort of take you through where this all came from, why the social framework, why, what are the roots for this report. So to begin, the social framework stands for the systems of cross-sector integration and action across the lifespan. In 2022, our Scientific Advisory Council, which is a group of 11 researchers, clinicians, experts from diverse sectors and backgrounds who all have expertise in social connectedness and disconnectedness, recognize that we have a really big challenge, which is that despite strong evidence of the adverse effects of social disconnection, there is no gold standard approach to mitigating these risks, and that no approach is likely to be the right solution given the variability of underlying causes and applicability for different settings. And in response to that, we, with our Scientific Advisory Council, developed this really widespread framework which aims to facilitate and accelerate progress towards a society that values social connectedness across the lifespan and in all societal domains. Next slide, please. So as you can see on the graphic depicted here, the framework really aims to illustrate untapped opportunities to influence population health and draws upon, merges, and expands upon the socio-ecological model and the health in all policies model. So as you can see here at the center of the graphic, first we place people. Individuals and communities, people we know who are experiencing disconnectedness or experiencing isolation and loneliness. And we always keep in mind the person and what people are going through individually at the center of our work. And beyond that, you can see levels of influence depicted in these sort of green rectangles, which illustrates the interpersonal, organizational, institutional, community, and societal levels of the socio-ecological model. And these all represent potential contributors that will lead to additional social isolation and loneliness, and also solutions for disconnectedness that can be applied at each of these levels of influence. Next, you'll see the sectors of society, which are depicted in these white circles with the icons all around the individual, and illustrates the health in all policies model, which was developed by the World Health Organization and the Centers for Disease Control. And those are really opportunities in each of these sectors to address social connectedness and for cross-sector collaboration, which is a real focus of ours and what we're working toward as we develop these reports. And lastly, you'll see in the purple arrows behind the graphic, these are really key cross-cutting areas of focus that we keep in mind as we develop these reports, thinking about risk factors and experiences of individuals across the lifespan as they contribute to social connectedness and disconnectedness, a key value to make sure that diversity, equity, inclusion, and access are put at the forefront as we investigate opportunities to advance social connectedness, and considering the opportunities to advance evidence and apply evidence at all different levels. Next slide, please. Great. So that brings us to what we're here to discuss today, which is our newest report on the work, employment, and labor sector and the objectives that we hope to accomplish utilizing the framework. We have sort of three key objectives. The first is to equip workers, managers, organizational leaders, and researchers, and many others with approaches and policies that can be tested and used to address social isolation and loneliness and create more high-quality connections. And I'll pause also to mention here the way we think about this, as you can kind of see depicted in the social framework model, is that not only is there an opportunity here to influence the experience of individuals, let's say at the center at work, but also consider who are the individuals with whom folks may interact with at work, like their customers. What are the communities that businesses are operating in and interact with on a daily basis? And then beyond that, what are the outputs and opportunities for organizations to influence the experience of social connectedness for society at large? And we bring that perspective throughout our report to think about opportunities to improve social connectedness for all of these different stakeholders. Next, we aim to identify gaps in the evidence base and identify future areas for research that can be tested and implemented through work. And we're so glad to see you all here today, because we hope that this report will inspire new ideas for you to test and develop, or if you are testing and developing some of these solutions, we'd love to hear about those to further the evidence base and further knowledge about how social connectedness can be advanced through work. And lastly, to provide evidence-based policy recommendations, both for organizations and for different governmental stakeholders to inform this work. Next slide, please. And a quick note, which is that we have a public comment period open until April 6th. You can access that. We'll post the links in the chat for all the information that you'll need. If you also scan this barcode, that will take you to offer feedback. We really are hoping for your feedback to improve the report, to ensure that it is accessible, usable, and is something that really can be a tool that all of you can use and benefit from. So we really hope that you will be inspired to share your feedback in areas that we can even continue to improve the report as we discuss what we found. And with that, I am excited to turn things over to Shannon Vivajal, who is our Social Connection Fellow, who was really an integral member of our team and conducted so much research for this report. And Shannon will walk through key promising approaches and policies that we found in the report. So that I'll turn things over to you, Shannon.
Thank you, Abigail. Hi, everyone. Thank you all so much for joining us today to discuss our report findings. This was a really interesting sector to research, so I'm excited to share what we've found. The report goes into greater detail on the solutions and policies listed on these slides, but we've chosen to highlight some pieces of information that stood out to us the most and that I believe will be most insightful to those of you on this webinar. At the individual level, we carried over a lot of the solutions that we've mentioned in past reports because there's just been so much research that shows they're effective in helping individuals from all populations foster their relationships and strengthen connection. For example, social skills building and cognitive reframing both improve individuals' ability to both feel and offer social support, empathize, and break out of or avoid this pessimistic mindset that people who experience social isolation and loneliness can often find themselves in. And that mindset can often keep them from engaging in or seeking out social interaction. The specific approaches that we discuss in the report that you can find more on are emotional intelligence skills, mindfulness, and cognitive behavioral therapy. Removing barriers and increasing access to mental and behavioral resources that foster these skills are just two steps that leaders can take to help employees become more connected. And mental and behavioral health providers can help leaders out by offering insurance premium discounts to for employee wellness programs. As a lot of the research notes, however, the onus can't solely fall on individuals to seek these resources out. So organizations also have to reduce workplace stressors or sources of these issues and improve their culture for these interventions to be successful. Interpersonally, on the next slide, organization leaders can help foster connection in the everyday interactions between coworkers, workers and their clients or customers, and workers and their families and friends. We recognize that leaders can also experience social isolation and loneliness and feel disconnected from their employees. But what was interesting is that the literature is still trying to develop evidence-based solutions to address this issue. One of the reasons why leaders may not experience the same benefits from these approaches as their employees might is that there's distance inherently baked into organizational hierarchy. And so that leader and subordinate relationship may not satisfy certain relational needs that leaders have. Regarding approaches, the literature discussed a concept called family supportive supervisor behavior, which is essentially offering employees support to manage a work-life balance so that they can fully and authentically connect with people both at and outside of work. Such behavior includes demonstrating an openness to discuss and a commitment to work through employees' problems, and also emulating healthy behaviors for employees to model, such as staying off emails after hours, taking mental health or family days, things such as those. Employees can also be supported by their peers, which one study found was the most significant contributor of reduced loneliness. According to the researchers, receiving coworker support was even more beneficial than receiving support from a manager. Additionally, other researchers found that having just one ally on your team can protect individuals from feelings of loneliness and exclusion. And for our last interpersonal approach, we discussed prioritizing team effectiveness through voluntary group dialogue and discussion activities. Research found that employees who participated in these groups felt a greater level of psychological trust, respect, belonging, and support with their coworkers, which are all key components of forming high-quality relationships and feeling meaningful connection. One of the studies that informed this approach was an intervention for 911 dispatchers, where every week they had an opportunity to answer a prompt that was something along the lines of, what is one piece of advice someone told you, or what is something you wish you had known? And the people who ran the intervention then took those answers and circulated them every week in an email to the dispatchers. And what they found is that this giving of advice was causing dispatchers to report a significant increase in feelings of support and belonging, even when they were really stressed out. And the researchers believe that these findings will hold for workers in other industries who may feel like they're undervalued or are less meaningful to society as perceived by society. Getting to the organizational level on the next slide. This was the level that I found most interesting to research. I wanted to highlight first the importance of worker autonomy. And I think worker autonomy will be particularly insightful to leaders who are just beginning to prioritize social connection, because their first instinct might be to make employees make them attend team bonding workshops or host work social events, or get their employees in as many face-to-face interactions as possible. But what the research shows is that requiring people who experience social isolation and loneliness to participate in events can actually further deter them from interacting with others and exacerbate the issue. Basically, when people who want to be left alone are allowed to be alone, they report lower levels of loneliness and improved well-being. From our research, we found that worker autonomy entailed giving employees choice over their work location, schedules, and participation in work events. And it also meant refraining from monitoring them during the workday, because less monitored employees felt more able to take breaks and socialize or ask their coworkers for support when they needed it. Another fascinating concept we explored was the power of workplace design. Research has looked at how various layouts and features can create an environment that fosters community and increases social interaction. Some of the designs mentioned include small 6 to 8 person meeting rooms, quiet rooms, break areas, fitness centers, and outdoor spaces. They noted like balconies. However, like other approaches, there's nuance in that having too many breakout areas or too open of a layout can actually increase experiences of isolation and deteriorate relationships, because people may not be able to locate their coworkers as easily anymore. so they feel disconnected from them. Additionally, some organizations make these changes without understanding how their workers use or relate to their space, and without recognizing how employees perceive their organizational culture to be. So it's not necessarily a if you build it, they will come kind of situation, because if workers think that their workplace is toxic and the design is out of touch, then they aren't going to want to use these spaces and features. Moving outside of the singular workplace and into the community level, the approaches on the next slide recognize that we can leverage organizations' influence on the communities they're located in to achieve greater social connection. Our report highlighted a solution that has been gaining in popularity recently, which is co-working spaces. And they have been effective in reducing social isolation and loneliness and fostering social connection among people who would not otherwise be connected through work. In the Work Anywhere campaign that we used during our research, and our subcommittee member, Dr. Sarah Wright, was involved in, they've done a lot of research and found in one of their surveys that an overwhelming majority of respondents felt most socially connected to other people when working in a co-working space. And that was opposed to working in other spaces like coffee shops, the traditional office, and even at home. Reinforcing this, a Harvard Business Review found that 83% of survey respondents felt less lonely after joining a co-working space. A few reasons behind their effectiveness are that individuals can create routines with like-minded or similar goal-oriented people, and that can build a sense of community. They also report feeling more authentic in their interactions with people because they're not directly associated with their workplace and they're more so outside of office politics. Increasing the prevalence and usage of co-working spaces would include things such as leaders reimbursing employees for co-working memberships and commute costs, as well as local governments subsidizing the creation of co-working spaces to make them accessible. So in low-income areas or rural areas, they can also allow organizations to repurpose abandoned buildings for co-working, which is an interesting thought. Another approach that I wanted to highlight on this level is the use of community green spaces. As we found through our research, when people have the opportunity to be outside in parks and gardens or walk through their neighborhoods, they also have more opportunities to engage in social interactions and strengthen their social ties to other community members. And when these features are easily accessible, people can more regularly interact and reduce their loneliness. Here, leaders from organizations, local government, and community organizations can all collaborate to co-create these spaces for their employees and community members. And finally, bringing it to the largest level of influence, society. To foster social connection through work for society at large, we encourage everyone to help normalize social isolation and loneliness, educate others and promote awareness of the issue, and advocate for policy change. Social isolation and loneliness are often stigmatized as individual problems stemming from personal choices, when it's really a systemic thing that we need to address. And not to equate them with mental health issues, but we did pull from mental health literature because it shows that creating media awareness campaigns and having leaders use their platforms to discuss their experiences or advocate for solutions are promising ways to challenge stigma and inspire change. Since COVID, I think that we've all seen leaders become more forthcoming about their experiences and struggles with mental health, and the media has covered topics like burnout and quiet quitting, but we can be even more intentional in naming the underlying role that social isolation, loneliness, and connection has been playing in our lives. Additionally, we can be more intentional in thinking about how products and services impact these experiences as well. As Abigail mentioned, we should be thinking about social connection for customers and clients, and taking a page from organizations like Building H or Fitwell, who rank or certify organizations based on how their products, services, or workplace design impact employees and community health, we believe that creating a certification for organizations and products that increase social connection is the next step to achieving a socially connected society. Hopefully, hearing some of these approaches has sparked some ideas for you all to take back and incorporate into your work. Of course, check out the report to learn more details and more information about the approaches that I didn't talk about today. But with that, I'll turn it back to Abigail to discuss some of the cross-cutting themes that we considered during our research.
Wonderful. Thank you so much, Shannon, for running through some of the key learnings from our report. Thank you for the next slide. As we've mentioned, if you think back to the graphic for our social framework, there are key cross-cutting considerations that we always keep in mind as we develop the research and the findings for our report. And we featured a couple of key things on the screen here. There's much more included in our report, and would love your feedback on those. When we think about inclusion, diversity, equity, access considerations, we consider what are things that keep people apart, and at a really sort of root level when it comes to diversity and inequitable access to things. And of course, among that, discrimination, microaggression, and microinvalidations at work are a tremendous barrier, as literature shows, to, of course, forming connection and much less meaningful social connection. And for those of you who are engaged in DEIB solutions, we hope that you'll consider how social connectedness can be an outcome that can be studied and work towards, high quality relationships and all the things that stand in the way of forming high quality relationships at work. Just a small selection and many more considerations that we discuss in our report. Along with different lifespan considerations and things such as, age discrimination, gender discrimination, really, really important issues that are keeping people out of work or siloing them when they are engaged in work. And some of the other things that we've put up on the screen here are some of the key research gaps that we identified through our research. Again, this is just a small list, and we believe really together that we can all be a part of testing and developing solutions, like Shannon has mentioned, for leaders who themselves are experiencing social isolation, workers in non-traditional settings like gig workers. There's really limited literature thinking about someone who, let's say, doesn't work in a traditional office setting or a traditional service worker setting. Considerations for digital spaces, and of course, as we're all joining on Zoom, how work has now transitioned to online for many, or hybrid work environments. What of the literature that has been studied and the solutions that have been studied can be translated online, and what are some particular considerations for those who are, say, working from home versus working in person? And lastly, as Shannon's mentioned, sort of a methodology to evaluate the impact of products and services. Next slide, please. And with that, I'm excited to invite Jessica and Karen back to the stage to share, as leaders in this space, what were some of their key learnings from the report, and what are things, if you're a leader in your organization and others in this space, what are some things that you can think about and take away from our presentation today? So I'll turn it back over to you.
Thanks. I'm going to go first with a couple of the takeaways that I felt were really important to highlight. One, some of you are aware that the U.S. Surgeon General report was published last year on the framework for workplace mental health and well-being, and it names social connection and community as one of 5 essentials for workplace mental health and well-being. This report is a fantastic complement. We, of course, referenced that report and looked into what it provided, but wanted to really make sure that what we provided in this report went beyond what was offered there. And so if you are familiar with that report, this is going to go a little bit deeper, a little bit broader into some specific evidence-based strategies that maybe weren't covered in as much depth in that report. Also, as an outcomes researcher, I'm always interested in looking at what the evidence base has to say about why this is important as an issue for workplaces. And we now know, after completing this report, that robust scientific evidence has shown that social connection promotes improved health and well-being, which many of us suspected based on our experiences during the pandemic, but it also contributes to work success, while social isolation and loneliness significantly increase the risk for a variety of negative outcomes. There are strategies in the report focused on promoting and strengthening social connection and reducing social isolation and loneliness throughout the WEL sector. And this holds tremendous promise for employee health and well-being, but also for team and organizational success and the social connectedness of even our customers and society. A third point that I wanted to bring up is that employers, researchers, workplace design experts, community leaders, and others have already begun to develop and implement evidence-based solutions. They have been drawing upon the research that exists, the theory that exists to already begin to test some of these solutions. And this report includes some emerging examples, some case examples. The report, what I love about it is it goes beyond individualistic approaches, which you heard about from Shannon as she went through each of the different levels of influence. And it recommends a multifaceted approach. While it might be very familiar to us to be focusing on individualistic solutions, this report can go a long way towards helping us to look into some of these other levels of influence to address social connection, isolation, and loneliness. And we can now begin to look at work processes, policies, facility design, leadership behaviors, and team interactions to foster stronger social connections. And so I highly encourage you to dig deeper into the report for all of those reasons. Karen, what were your personal takeaways and got you excited about this report?
Thanks, Jess. Those were great. I'm going to try not to overlap with the ones that you've called out, but I will focus. Well, I will just mention, because I don't know if we've focused on it or if we've called it out specifically, but there is an action brief of sorts for leaders that was taken from drawing the leadership specific pieces from this report. So I would encourage everyone to take a look at that. And so my takeaways, I'll focus a little bit more on what leaders can do. 3 things: resource manager training. Supervisors' interactions with their direct reports are among the most powerful influencers of overall employee well-being. And so organizations need to ensure that managers are well-trained in identifying individual indicators of loneliness and social isolation and how to support that social connection of their teams. 2, leaders should think about work itself as a social determinant of health. And you touched on this some, and of course, Abigail and Shannon as well, but leaders need to consider the conditions of work, worker autonomy, workplace design, to increase the levels of social support and provide opportunities that create a sense of meaning and community. And finally, 3rd, integrate with well-being efforts around inclusion, diversity, equity, and access. This working employment and labor sector has an opportunity for significant impact to mitigate discrimination and harassment toward marginalized groups, which are shown to decrease employees' sense of belonging, trust, and perceived social support. So leaders can ask the questions of themselves: are our strategies and approaches inclusive? Do some groups benefit more than others? And who is missing from our current efforts? I'd love to hear, I think we're going to turn now to Q&A. I would love to hear key takeaways from others.
Great. Thank you so much, Jessica and Karen, for sharing those really important takeaways and for shouting out our guide for leaders that Shannon has now put in the chat, which is really directed for making the case and giving, presenting it sort of a very high level. What are some solutions that leaders can implement in their organizations today? With that, actually, I'd love to raise a question for you first, Karen, to answer, and then to hear from you, Jessica, which perhaps you've touched on a bit throughout our presentation, which is, for folks who are on the fence about social connectedness. They do want to make changes in their organizations, whether that's, you're a departmental leader or a manager or even a worker in your organization, and certainly leaders, but they're not sure how to make the case for why people should value social connectedness. And, among the many different things that leaders care about and need to consider, what would you say is sort of top line? How do we make the case for social connectedness to be something that should be addressed through work and through this sector at large?
Yeah, I'll throw a couple of thoughts, and I would invite Jess to share others as well. But I don't think it's any different than the case that the nation is aware of the importance of supporting mental health, physical health to support mental health, and the absolute mental health crisis that we're in. And an integrated approach for well-being is going to include all of those pieces. So it doesn't need to be a fragmented, siloed approach. It would be easiest to incorporate into a program or a comprehensive plan that's already in place within an organization. For organizations that haven't, there are case studies galore that demonstrate the value case. Jess has highlighted research in some of her remarks about the impact that supportive well-being practices for employees have on employee productivity and presenteeism and absenteeism and happiness. So I hate to be sort of dismissive about it, and I understand that there are some real questions for those who are trying to get started, but that would be my early response. Jess?
Yeah, thanks for those comments, Karen. As I started to dig into the research for this, there were a couple of things that really stood out to me. First of all, loneliness is a team performance issue. If a single member of a team is experiencing loneliness, it affects the performance of the whole team. And so, we come to work as individuals, but we work in groups, we work in systems. And so when one person's well-being is affected, including their social well-being, it influences everybody on the team. If they become more withdrawn, more reluctant to contribute, it affects the whole team's engagement. And so that research is important to note. But then our expectations for our work have changed over the past few years. One of the studies that Work Anywhere has done has shown that workers today expect stronger social connections at work. It's something that they're looking for. And some employers might be dismissive and say, well, you can get your social connection outside of the workplace, right? But we spend more than half of our waking lives within the workplace. And when we're not at work, we're thinking about work, or maybe we're doing after hours emails. And so the quality of our relationships with one another do have a substantial impact on our well-being, not just while we're at work, but when we're away from work. And as employees have increasingly experienced this during the pandemic, at the same time, many of their opportunities to connect in their communities went away, and those haven't necessarily come back. And so I think workers are more and more looking to say, if I'm going to be spending so much of my time and energy in collaboration with these coworkers of mine, I would like to make sure that it's a valuable experience. And so I think employee expectations of their employers have changed. Employers can't afford to ignore this expectation because it's about attracting and retaining top talent, keeping people engaged in their work. And this is a critical part of that, I think.
Yeah, absolutely. Thank you so much. And I was thinking too, Shannon, perhaps you can touch on some of that really compelling data that there is that speaks to how social disconnectedness, impacts the bottom line for a lot of companies. And of course, we value social connectedness for social connectedness sake. We know how critical it is for our health and well-being as individuals. But it also said there's also all this data that shows that it's really important to invest in this for outcomes. Can you maybe touch on that a little bit, Shannon?
Yeah, so like Karen already mentioned, there's the aspect of absenteeism, taking sick days because you're lonely and you don't want to go to work, reduced productivity. And Cigna has two reports that we cite in our own report that highlight that basically the amount of sick days that people are taking because they're lonely roughly translates to about $406 billion nationally. And so if you were to break that down by employee, it's about $4,200 per employee. And if you increase social connection, you basically increase your productivity, you increase the number of days that workers are willing to show up. You can also boost your stock performance. They find that companies who are committed to helping their employees do better in terms of on the stock market. So If you'd like, I could go into a little bit more of the numbers, but I think that there's a ton and they're all in the report. So I think that they're also in the leader guide that we posted in the chat. So if anyone wants to check those out.
Great. I hope you will. and feel free also to post, questions in the Q&A feature if there's anything you'd like for us to cover in the next few minutes. We received a question. This is about the research that we included in the report. How much of the research that we've cited came from randomized control type research versus survey type research? I can probably give sort of an overview, and thank you for this question, about our process in terms of how we included research in this report. And then I think Jessica and Shannon, you please chime in about, our understanding more broadly of where the research is when it comes to social connectedness and disconnectedness and work. In our report, and you'll find this later on in the report, we outline our process for sort of inclusion criteria for how we decide to include solutions in the report and how we present them. So we have identified those based on 4 criteria. One, that solutions are grounded in a theoretical and conceptual framework that will act upon some of the constructs of social connectedness and disconnectedness. 2, that it's been studied and, in relation to evaluating outcomes related to social isolation and related experiences of, belonging, connection, and disconnection. Inclusion at work, social support, lots of other things we talk about in the report. 3, that these solutions have demonstrated an impact on one or more of these outcomes through a peer-reviewed study. And 4, that they have been tested in a workforce setting or among adult workers. And as you'll see, as you kind of read through the report, we did choose to include some that maybe don't meet all of these criteria, but we think holds a lot of promise should there be more testing and evaluation of them. And you'll see sort of how it's denoted to explain some of the limitations of the research, why we think this is really compelling research, not only what we know in relation to the sort of application in the workforce sector, but if this solution has been applied in other sectors for other populations, but it just simply hasn't yet been tested specifically, at work or for this purpose of working through the workforce. So it's kind of an overview, but I'd love to turn things over to you, Jessica, if you can talk a little bit about, and Shannon, about, the research as it relates to this, sector and world, and where are we in that?
Shannon, do you want me to start, and then I'll toss it over to you to add on from that?
For sure, yeah.
Okay, so the state of the research really is emerging in this area. And so, if it's even appropriate for us to be doing randomized control trials with this type of work, which I'm going to call into question, I'm not sure that that's the most appropriate design for this. It is still very, very early days. And so I think in some cases, we've got some research that's quasi-experimental, where we've got pre-post with a comparison group. That research is existing. But the fact of the matter is, a lot of the stuff that's been emerging in this area has really been more along the lines of organizational pilot testing. And when things are published in the peer-reviewed research, we are seeing that there are more robust designs used. But the fact of the matter is, a lot of the testing that's going on isn't necessarily being published in peer-reviewed journals, and they're not necessarily using these more rigorous scientific designs. It does exist out there, but I would say that was one of the challenges as we were looking through the solutions to provide in the report, was pointing to those with the strongest level of research. I would like to say a little bit about the nature of randomized controlled trials. Remember that when we talk about social connections, we're talking about interactions between individuals. We're talking about groups and teams in the workplace. And so we're also talking about norms. And so it might not be appropriate for us to be using randomized control designs unless the unit of analysis is at the team level or the group level or even the organizational level, depending on the nature of the intervention. When you're putting policies into place, it's affecting whole business units, for example. And so in that case, you're going to have to be comparing business units against business units. That's really hard to do in everyday practical settings. Right now, we're just making a call for, if you're an employer and you're using some of these strategies, please share them, publish them, show people what you're doing, even if it isn't a randomized control trial, because we need this evidence to get out there so we can continue to build upon it. So there is a lot of work that is left to be done, but I'm excited about the promising level of research that we do have to draw from in this report. Shannon, what more do you have to say about that?
You covered a lot, but yeah, I think one of the things that we were very intentional about was making sure that we delineated between evidence-based and promising, because there were many times where some of the surveys and self-reported statistics were promotional, and they were just kind of a look at what we're doing it so great. Like we can't confirm that. So we were trying to determine how best to balance what corporations choose to put out there as their kind of public image and the evidence base. So I think that where we landed in terms of our societal level policy recommendations were, please collaborate more. Please, researchers, reach out to more lay people. Please, businesses, help researchers out, and let's connect the two.
That's a really great, important point. And thank you for kind of reviewing the lay of the land. It's definitely, I think, if one of the takeaways is absolutely, I think what Shannon, you just said, that we hope that this, spurs more collaboration and more sharing of research and learnings. We hope that of course, you'll fill out the feedback form and share your thoughts, but please reach out to us. I mean, if you are conducting some of this research and willing to share that with us, we'd love to learn that and share that out with others as well. Great. So we had another question from a member of our audience. Why do you think the sell, so to speak, of social connection or social health to business leaders is so difficult at this point, even though the results that we're sharing are so compelling? Karen, would you want to take that question first?
Sure. Thanks, Abigail. I mean, I think first it's just an education and a social media campaign just to, make leaders aware that this is an issue. And don't assume that the sell requires dollars. There are a lot of ways that are highlighted in the report that employers have at their fingertips to leverage community resources through the green spaces and other community resources to leverage through public-private partnerships or just collaborations. Collaborations has been mentioned a few times. But ask your employees, ask your employees what their pain points are, and it might only require easy, simple tweaks to existing policies, practices, and programs to integrate and address those social isolation issues within things that are already, happening within the workplace. But one low-cost solution is institute a volunteerism policy. Here we are a small staff and don't have this, huge well-being program or resources to support that, but we have a volunteerism policy. Our employees can go out and support community volunteer efforts during work time. So, there are some easy no or low-cost solutions that employers have available to them.
And to add on that, what we also discussed is that some of the solutions and approaches that we discuss in the report means stopping doing, don't do the things that you're currently doing because they're not evidence-based and they can actually exacerbate the issue. Don't be spending a ton of your budget on elaborate work events when not everyone wants to attend those. Don't completely redesign the office if it's not going to help the employees, if they don't have input in it. So I think making that point, we really try to do it in the report, but more people, I think, should be stressing that point of please be using evidence-based approaches and not just trying to pilot your own.
Great points. Well, thank you all so much. This has been really just interesting to hear some of these questions. I think they're really important, meaningful questions. And we hope that all of you who are watching and joining us today will kind of engage with these, and feel free to share us your thoughts as well. And we hope that you will, of course, read the report, read our guide for leaders, offer feedback. If this spurred any ideas, please connect with us over here at the foundation and our team. And I'll also make a note that we also released a guide for an executive summary for our education report, which was released earlier this summer. If that's something that's interesting to you, please check it out and share this with your networks. And all in all, thank you so much, Jessica, Karen, Shannon, our entire subcommittee. And thank you so much to everyone who joined us today. We really appreciate it. And it's been wonderful having you all here today. Thank you so much.
Thank you.